Imagine you wake up one morning, 50,000 years ago. Your head is pounding. Your body is burning. Every joint aches. You have no doctor, no hospital, no pharmacy, not even an aspirin. You have a fever. And nobody on earth knows what a fever is. This is what ancient humans did when they got sick. The first thing you need to understand is how ancient humans thought about sickness, because they did not think about it the way we do at all. We think about germs, bacteria, viruses, infections. Ancient humans had none of those concepts. As far as they were concerned, sickness did not come from inside your body. It came from outside it. From spirits, from demons, from enemies who had cursed you, from gods who were angry about something you did. If you were sick, it meant something invisible had entered you, or something important had left you. Your soul had been stolen, a demon had moved in. The universe was punishing you for a reason you needed to figure out quickly. This sounds completely wrong to us, but here's the thing. It was not entirely useless. Because if sickness comes from spirits, then the most important person in the community is not a doctor. It is someone who can talk to spirits, a shaman. The shaman was the first doctor in human history. And they were remarkably effective at one specific thing that modern medicine still struggles with: making people believe they would get better. The shaman would perform ceremonies, dance around the sick person, chant, burn things, make dramatic gestures, wear frightening masks to scare the evil spirits away. And the sick person lying there watching all of this would feel something shift, not because the spirits left, but because the human brain is extraordinarily powerful when it comes to healing. When you genuinely believe something is working, your body responds to that belief in measurable physical ways. We call it the placebo effect. Ancient humans accidentally discovered it tens of thousands of years before we named it. But shamans did not only use belief, they also used plants. This is where ancient humans were genuinely brilliant. Through thousands of years of watching animals and experimenting on themselves, they built up an enormous knowledge of which plants did what. A Neanderthal woman who died 50,000 years ago in Spain was found with a tooth abscess. Analysis of her fossilized dental plaque found traces of yarrow and chamomile bitter plants with almost no nutritional value, but known today for their anti-inflammatory and pain-relieving properties. She was not eating them for taste. She was using them as medicine. Yarrow in particular is remarkable. It stops bleeding when applied directly to a wound. It reduces fever when consumed as a tea. It fights infection. It is so effective that it is still used in herbal medicine today. Ancient humans were using it 50,000 years ago without knowing a single thing about why it worked. They also ate clay and soil. This sounds disgusting, but it was not stupid. Certain clays contain minerals that neutralize toxins in the stomach and kill harmful bacteria. Modern medicine actually uses a refined version of this kaolin in treatments for digestive problems. Ancient humans watched sick animals instinctively eating clay and copied them. The animals were right. But here is where it gets truly strange. Some ancient humans decided that the problem with sickness was that something was trapped inside the skull, and the solution was obvious. Make a hole in the skull and let it out. This procedure is called trepanning. And archaeologists have found thousands of ancient skulls with deliberate holes drilled or scraped into them from Europe to South America to Asia, going back over 10,000 years. The tools used were sharp stones. There was no anesthesia, no antiseptic, no understanding of infection. And yet, many of those skulls show bone regrowth around the holes, which means the patients survived. They survived having a hole carved into their skull with a rock in the middle of a field 10,000 years ago and lived long enough for the bone to start healing. Some skulls show multiple holes drilled at different times, meaning the same person went through this procedure more than once and kept surviving. We still do not know exactly what trepanning was for. The most likely explanation is that it was used for severe headaches, seizures, and mental illness conditions that ancient humans would have attributed to something trapped inside the head trying to get out. In some cases, it may actually have relieved pressure on the brain from injuries and accidentally worked for entirely the wrong reasons. The other thing ancient humans did when someone was sick was something much simpler and much more powerful than any of this. They stayed. Archaeological evidence shows that severely injured and chronically ill ancient humans were cared for by their communities for months and sometimes years before they died. A Neanderthal man found in Iraq had lost his right arm, was blind in one eye, and had severe arthritis. He survived into his 40s ancient for that era, which would have been completely impossible without other people feeding him, protecting him, and keeping him alive long after he could no longer contribute anything to the group. Taking care of sick people who cannot take care of themselves is not an obvious survival strategy for a small group of hunter-gatherers where every person needs to pull their weight, and yet they did it anyway. The instinct to help sick members of the group appears to be one of the oldest things about us, which might actually be the most important medicine ancient humans had. Not the plants, not the shamans, not the holes in the skull, just other people who refused to leave.